Okay, we're going to do kidney stone today. We see a lot in the ED. Our goal is pain relief and nausea, vomiting relief. Very painful. I think the key is a position of comfort. They cannot find a position of comfort. Like appendicitis, they don't want to move. It hurts when they walk. Broken bone hurts when you move it. Better if it holds still. There's no position of comfort, and they're in crazy amount of pain. Just nothing gets them better. Kidney stones, there's three major places where they stick. The first one is when it comes out of the pelvis, the kidney, ureter, bladder. When it comes out the pelvis here, it goes from about a centimeter across here down to about a couple millimeters. So as it comes out here, it can get stuck right here. Very common. When it kind of crosses the pelvic rim, they've got some arteries and veins down there in the bones. It can get stuck kind of here. And also common, we see a lot, is right at the bladder ureter junction, and that's because it's going from there's some muscle, the bladder here, that sometimes the stone can bounce in and off. This muscle prevents your urine to go back up there. So three spots is when it comes out, across the pelvic rim, and down low. As you know, with kidney stones, sometimes they won't cause pain, or they won't be painful or cause you, problems. So if you draw a ureter, it comes down like this. If the stone, they're kind of jagged, nasty things. They're not normal, not like a river stone. They're more like a pumice stone. So if the urine can get around it and into the bladder, sometimes it doesn't cause pain. But if that stone kicks sideways and now is scratching the internal ureter, it's going to hurt them. And also, as the urine is coming down, it hits this stone and goes back and puts pressure back on the kidney. And that pressure back on that kidney causes this intense pain. We've all seen it: nausea, vomiting, intense pain. 8% of kidney stones are calcium oxalate crystals. About 10% of the stones are struvate type, so struvate. And that's usually kind of found in infection, usually in women. Proteus, Klebsiella, a couple different ones can cause those. Another 10% are uric acid type stones. That's people with gout or chemotherapy. Risk factors for kidney stones: obesity, low urine volume, excess dietary meats, the purine in the meat, excess dietary sodium, insulin resistant, metabolic syndrome, family history is key. Ask if they got a family history. Gout, inflammatory bowel disease, not moving much, certain medications, acyclovir, loop diuretics. These things could all be causes. Remember, clinical features: extreme pain, can't get a position of comfort, usually flank pain radiating down to the groin. Best test for them: a non-contrast CT, about 97% sensitive. Ultrasound's about 85% sensitive. Remember, there's no bad things with ultrasound. There's no radiology type, things with them. Plain films about 60%, up to 60%. Hematuria, blood in the urine is presented about 85% of the times with kidney stone. Not always, though. Treatment for these, of course, is non-steroidals. IV Toradol is great. Opiates, of course, Dilaudid, morphine, whatever they like. Fentanyl, remember, fentanyl kicks in a little quicker. Some people do IV lidocaine, a milligram per kilogram IV. Always check them for urinary tract infections. If they're infected, that could be a lot worse. Fever, renal insufficiency, very dangerous. Size of stones, 5 millimeters or less will most likely pass. Up to 7 milliliters can pass. It can be from a minute to 30 days. The bigger, obviously, the longer to pass. 8 millimeters and above, they probably need some type of intervention. Our goal is pain control and make sure there's no infection. Obviously, pain out of proportion and infection, they probably need to come in, or large stones, they probably need to come in. We're lucky, our urologists work great here together. They cover each other. Real quick, a couple indications for admission, of course, is intractable pain and vomiting, urosepsis, single or transplanted kidney with obstruction, so if they only have one kidney, really consider omitting them. Acute kidney injury, which is not real common actually. The other kidney usually can kick in. It can function almost 185% more than normal. Severe other medical conditions. I've had them, they suck. I will say though, I've always gotten better with Toradol and Reglan IV. I've never had to have narcotic for mine, but remember, Toradol, Reglan works great. Benadryl works great.